Today we're going to learn about HIV medication assistance and how to get streamlined access through the organization HarborPath. Just a few housekeeping things before we get started. You will remain on listen only for the duration of this webinar, but if you have any questions for our host Noreen during the presentation, or you think of some at the end, please go ahead and type the questions into your control panel at any time during the webinar, and Noreen will answer questions at the end. This webinar will be recorded and up on the NeedyMeds website and our YouTube page in the next couple of days if you want to take a look at that. And I believe also Noreen's slides should be available. Is that right, Noreen, after the presentation? Yes. Okay. That's correct. Okay. So I mentioned today we're going to learn about streamlined access for HIV medications through HarborPath. Our guest host is Noreen O'Donnell. She's the Director of Program Services for HarborPath, which is a new nonprofit organization. It's an HIV medications assistance program that's currently piloting in several different states. As the Director of Program Services, Noreen oversees program development and provides technical assistance to HarborPath portal sites. I'm Elizabeth Messenger, and I'm the Director of Outreach and Education here at NeedyMeds, and this is one of our special topic webinars. We hold our regular NeedyMeds webinars, also hold webinars in a variety of different topics that we think will be relevant to our website users, such as this one. So today we're just going to start with a quick poll, and then Noreen will get started with her presentation. So we're going to launch the poll now. What type of setting do you work in? Please select one of the following: AIDS service organization, HIV clinic, community health center, or other. And I'll give you just a minute to respond, so please start responding. Give you a little bit longer. Okay, so it looks like the majority of you work in somewhere else other than these options. We have 4% HIV clinic, 17% community health center, 79% other. I wonder if folks want to chat into their chat bar or into their control panel some of the other places that they work, just so we can get a sense of where you're coming from. Well, maybe during our next break we can check in to see where other people are. But anyway, we will let Noreen get started now. So Noreen, would you like to take it away?
Okay, great. Thanks, Elizabeth, for that introduction, and thanks also for the poll. It's nice to get at least a little bit of a feel of who the participants are before we start. And from there, I'm just going to launch in, and I'll start by giving you a brief agenda of what we're going to cover today in the webinar. I'd like to start by giving you a little background about sort of the history of HIV and patient assistance program applications. From there, I'll introduce the HarborPath program, and after that, I'll actually give you a brief tour, so to speak, of our online portal. And after that, I can talk about how your organization can get started using HarborPath, and then just a glimpse into the future of HarborPath.
So while you're getting into that, Noreen, it looks like we have someone from a state public health social services, someone from a cancer center, and someone said they were from a community health PAP. So wide variety.
Okay, great. Yeah, that's great. Thanks for that. So you'll see the screen before you, and it gives you some background about HIV and patient assistance program applications. So there are 1.1 million people living with HIV in the United States. And estimates are that approximately 25% of them are uninsured at some point during a benefit year, whether they're sort of consistently uninsured or if they're just experiencing a gap in coverage. An example of a gap in coverage would be perhaps a waiting period to get on an AIDS drug assistance program. Elizabeth and I were talking a little bit about what's known as ADAPs, and every state does have an AIDS drug assistance program, but there are varying times for application processing. So a person living with HIV could be eligible for their state ADAP, but it could be 4 to 8 weeks before they can actually get into the program. So they would experience a gap in coverage throughout the year. So we have shown that those people who have experiencing that gap in coverage are relying on the pharmaceutical companies' PAPs as a safety net. And it's estimated that 20,000 to 30,000 patients are currently accessing HIV PAPs throughout the U.S. And while the manufacturers of HIV medications all offer PAPs, industry and public health officials and HIV advocates have long recognized the need for a common portal to access medications through the patient assistance programs. There are some unique needs for people living with HIV/AIDS and their medications. For those of you who are working specifically with this population, you're aware that a person living with HIV is often prescribed multiple antiretrovirals, and that sort of faces them with the need to go to more than one pharmaceutical company to access their complete regimen. This can lead to a host of problems. If a patient has to access 3 different companies, for example, through their PAPs to get their medications, that's perhaps 3 different eligibility criteria, 3 different shipping processes, sort of those things that could be potential barriers to getting that patient their full regimen in one package at one time, and that potentially could lead to non-adherence and then viral resistance, which of course becomes a public health issue with further spreading of the disease. So there is a little bit of a unique element to people living with HIV/AIDS and their need to access medications through PAPs. And as I stated before, there has for a long time been a need to simplify the process in order to streamline and speed that access. I mentioned the AIDS drug assistance programs that are available in every state. Since about 2006, there have been periods in this country where there are significant waiting lists for the AIDS drug assistance programs, and that really, in that past, 8 years or so, has led to significant highlighting of this need for the single point of access. So enter HarborPath. HarborPath's mission is to streamline the PAP application process for people living with HIV/AIDS who are uninsured and have no other access to HIV meds. HarborPath is operating an electronic online common portal where case managers or RNs or patient advocates can go to access HIV meds and to process HIV patient assistance program applications. HarborPath is a nonprofit. I think Elizabeth mentioned that in her introduction. And we are located in Columbia, South Carolina, and we were launched in July 2012, so we're not yet a year old. The organization is a cooperative effort supported by the Clinton Health Access Initiative, the National Alliance of State and Territorial AIDS Directors, and pharmaceutical companies, and with the overall goal to improve access to HIV meds through the PAPs. We also recently announced Elton John funding, so that's very exciting for us. We're very excited about that partnership. And sort of backing up a bullet, we developed this online portal, and the initial release of the HarborPath portal is really the product of input from all these stakeholders that you see there. We had input from HIV case managers, public health department staff, pharma companies, NASDAQ, CHI, and the system was developed in alignment with the business rules of all the pharma companies' programs so that all the necessary data is captured in one place, regardless of which HIV drug is needed. And what we're going to do, as I mentioned on the agenda, is take a couple minutes and I'll give you a peek into the portal and can show you how we did all that and sort of how that looks for a user. So right now, HarborPath receives donated medications from Gilead, Merck, and ViiV. So we have on our shelves all of the antiretrovirals that are manufactured by those 3 companies. And we are able to dispense those meds through our contract pharmacy. We are in discussions with other companies, notably AbbVie, formerly known as Abbott, and Bristol Myers Squibb, and Johnson & Johnson. And so the overall goal is to be able to have the full complement of HIV meds at our pharmacy for dispensing for people living with HIV. And so, that's the vision, and we're getting there kind of one company at a time. We're really excited to have these first 3 companies supporting us, and that's been, we've been successful with these 3, and we know we'll be even more successful once we get the other companies on board. And so I mentioned that we have a contract pharmacy. Our contract pharmacy is Medvantix, and they are a mail-order pharmacy. They're based out of Sioux Falls, and they are able to dispense medications in all 50 states. So while we are not currently operating in all 50 states, again, once our vision is achieved and we are operating in many multiple states, our partner pharmacy is able to dispense medications to all those locations. And we do currently have sites operating in Alabama, Texas, Georgia, Florida, South Carolina, Washington State, and Washington, D.C. You'll note that most of those states and locations are in the Southeast, and that, not so coincidentally, is where most of the crises were in terms of people with HIV and their access to HIV meds. And so when HarborPath first launched, it was decided to sort of hit those southeastern states where there was sort of the biggest crisis. So that's where we're located, but we are open to expanding depending on, you know, where clinics are located and where the need is. Just a brief slide about some of the advantages of HarborPath, which you'll see when we actually go into the online portal. Using the HarborPath program provides direct access to all the Gilead, Merck, and Beef meds. Not only does it give direct access to those meds, the system will also generate all of the other HIV PAP applications through one set of data entry and one single point. The single point pharmacy services are very helpful. We have patients now that are on, for example, a Gilead med and a Viv med, and both those can be dispensed to that patient at the same time. We do commit to dispensing those medications within 48 hours of receiving the application. So it is a fast turnaround time, and that is also an advantage of HarborPath. That's not specifically listed up here. In addition to the patient focus, we do have a lot of administrative efficiencies. As you can imagine, using the online portal allows for one-time data entry per patient, one set of documentation for all the HIV PAPs, and also gives you access to record keeping and reporting online. And then, of course, all that reduces time spent on paperwork. And we all know that patient advocates and case managers and people like that certainly could use help in that category. And so we really do feel like there are a lot of advantages to our program. And you'll see that as we, like I said, take a look at the actual portal. This slide just shows quickly what the HarborPath patient experience would be. The title is maybe a little misleading because a patient themselves would not use our portal. It will be a case manager or a patient advocate or an RN, depending on the service model. And so it's that person that enters the HarborPath portal via our website, and they complete the application form. From there, HarborPath does the eligibility process on the application that's submitted, and drugs are shipped within 48 hours. On the back end, we have an IVR that allows patients to order their refills and continue with their regimen. What I'm going to do here now is to go to our website.
While you're doing that, Noreen, did you want me to launch the second poll?
Yeah, go ahead and do that.
Okay, so we have one more poll just to keep you all on your toes here. So how many of your patients currently rely on HIV PAPs to receive their medications in any given month? So judging by the first poll, I think this might be a smaller number than we first expected, but 0 to 25, 26 through 50, 51 through 100, or over 100, and you can go ahead and start responding. Just another second. Okay, so it looks like we had about 89% 0 to 25 and about 11% 26 to 50.
All right, thanks, Elizabeth. That's interesting to hear that. I will say, and so some of the folks participating may be surprised to hear that we actually have clinics that have up to 300 to 400 patients a month who are relying on the HIV PAPs. So you can see where a system like HarborPath would be absolutely beneficial to those organizations just to keep the patients on their meds. But we have other clinics that have smaller amounts of patients that they're using the system for. We have some places with as low as 15 to 20 patients, and they're finding it still to be a benefit for their service model. So what I need to do now, so this is the HarborPath website, and this is an open website that anyone can go to. You can learn a little bit about the program here, and you can follow us on Twitter. I encourage you to do that. And this is just a website that shows a little bit about the program. We've got some specific information for case managers, some information about patients. Primarily for the patients, we let them know that this is not a program where we work directly with a patient, but that they really need to work in conjunction with a case manager or an advocate to access our program. So what I'd like to do now is just to log into our site real quick and just give you a look at what the HarborPath portal is like. So if your organization is a HarborPath user and you have case managers who are accessing medications for their patients through our portal, they simply come to the login and put in a username and password. And sign in. And as a case manager, logging into the portal brings you to what we call the dashboard, which is basically a summary page showing you all the activity that your organization has had in the HarborPath portal. So obviously when an organization first starts, these numbers are much smaller. But as an organization over time uses the HarborPath portal, this is a way to sort of keep a handle on what kind of activity your organization has in our portal here. Primarily, a case manager would go to the PAP Applications section, and this is where a case manager would start the application process. And it's really quite simple. I'm just going to open up a patient's record. All this data here is sort of dummy data. It's our demo site, so what we're showing you here are fake patients. And so what I'll do, just to give you a flavor of what it's like to process an application through our portal, is I'm going to go to this patient here, Mr. Tess Cedric, and start a new application. We won't go through a whole application in the interest of time, but just, again, wanting to give you an idea of how easy it is to use this. And so the first step is simply selecting your state. And there you go to next. Here's where you would add the medication that you're looking to access. Our patient needs a triplet today. So add that medication. And you'll note here that a triplet is a Gilead medication, and it's marked with an asterisk, letting you know that that is a medication that will be dispensed by HarborPath. And so here's where you can see where using the portal makes life easier in an administrative way. All this information, because this is a patient I have processed an application for in the past, all his information is already in here. And of course, it's wise to review it to ensure that nothing has changed since the last time you processed an application. But we're going to say that for my patient, none of his information has changed. And so I can simply move to the next screen, which is an eligibility results screen. It gives me preliminary eligibility results, showing me that based on the information I've entered, my patient is eligible for the ATRIPLA. From there, I hit next. Step 4 has a little more detailed patient information, address. Here's where you put prescriber in. As organizations sign on to use the HarborPath portal, they're able to populate their prescribers in the system, and so it's easy to search for prescriber and attach them to your patient's record. Some shipping information, if the patient has a legal guardian or advocate, and then information about the prescription. I'll just add something here in the interest of processing this. So once daily by mouth. We could go to next. Here's where a case manager would elect to either upload the actual prescription via a scan, or if they can't or don't prefer to do that, they can go and fax it. This final step shows how a HarborPath form is generated, and I'll show that to you all real quickly, or as quickly as this will allow. So this is the HarborPath applications the system generates. You'll note that all the data that was in the system is now on this form. And so a case manager would simply print this out, fax it to us with the scripts and any other backup documentation, and that would complete the process. From there, we dispense the med, as long as the patient meets all the eligibility criteria. So it's actually a very simple process. And I'm going to go back to our presentation here and just tell you a little bit about the platform. All security and confidentiality requirements are met. Everything's HIPAA compliant. All our backend databases are encrypted. So all that is covered, because we all know the importance of that. And in the interest of time, we're just going to kind of roll on here, but I wanted to tell you, if your organization is interested in using the HarborPath portal, how you get started is very simple, and I'll give you my contact information at the very end. But we ask that all organizations that use us, whether it's a university-based clinic or a small aid service organization or a local health department or anything in between, we enter into a memorandum of understanding with you, and so your organization signs that and a HIPAA-compliant business associate agreement. And from there, we issue user IDs. There is no cost associated with using the program. Due to the generosity of organizations like the Clinton Health Access Initiative and the Elton John AIDS Foundation, there is no cost to users, so that there are no charges, but we do need that signed agreement between the two organizations to keep us all compliant with HIPAA. From there, we issue user IDs, get you all trained, and your case managers can begin using the portal. So the future of HarborPath will continue to add portal sites around the country, and we will continue to negotiate with the manufacturers, those companies that I mentioned early on. And we are, as of a couple of weeks ago, administering the NASDAD ADAP waiting list program. And so that's another sort of branch of our program. And we intend to be operating even after full implementation of the Affordable Care Act. That last bullet you'll see there is that we are also negotiating with companies to get hepatitis C medications onto our formulary and available for patients. So there's a contact information for me. And I think we're just about right on time to be able to answer a few questions if there are any.
Great, thank you so much, Noreen. Yes, please do start typing in some questions. Again, a reminder, the webinar will be recorded and up and on our NeedyMeds webinar page, as well as on our YouTube page. You can always check out our webinar page for our upcoming webinars. And just in case you weren't already familiar with NeedyMeds, I just wanted to mention that we're a national nonprofit, and our website has all different kinds of resources that can help you afford the cost of medications and healthcare. So we have a similar mission to HarborPath that we kind of go about in a different way, but we're really all about helping people get their medications and affording their healthcare costs. So we're really excited to have Noreen come on today and teach people about HarborPath, and hopefully this might be right for your clinic or healthcare facility that you work at. So we are going to start answering questions. So there's some questions about if the program can work for individuals who are younger than 18 or undocumented, and I'm guessing your answer, because I know with my experience with PAPs, Noreen, that you're not running the assistance program, so it's based on their guidelines, correct?
That's correct. So any company, which fortunately is most of the manufacturers of antiretrovirals, but any company that serves people who are undocumented will serve them too. And right. People under 18, if your patient is under 18 and they're on a medication that we have, absolutely, we'll serve them.
So you started mentioning that you were going to add Hep C medication. So there was a question about if you're thinking about adding any other kind of disease states to the portal.
Well, we like to say that we have to crawl before we can walk, so we're really working hard to get all the HIV meds on board, and then Hep C, and then we'll kind of go from there. But right now, the plans are really around HIV and Hep C.
Okay, and to confirm, the training is free, the program is free, there are no costs associated with it?
Correct.
Okay. There's a question about whether there's any other similar programs happening in other parts of the country, the Northeast region, or anything like that.
Not that I'm aware of, but again, we work, we're sort of a national program, even though we're in a pilot phase and only in those 6 states I mentioned. We are willing to, enter into discussions with sites that are anywhere where the need is right now, actually.
Okay, and again, I think this is going to be program-based, but there's questions about how it works when people have insurance, they have high co-payments, or maybe some other particular needs, how that works.
So if we have patients who have insurance and maybe their insurance is inadequate or they have high co-pays or really any co-pays at all, those are not patients that we're going to serve, because right now the companies who have donated medications to us have not given us sort of the authority to kind of make exceptions. And so if you had a patient who had insurance and, for example, was on a Gilead med but had a high copay, I think really appealing directly to Gilead's program would be the way to go.
Yeah, we're getting a lot of questions like that, because people have Medicare and things like that. And we also at NeedyMeds often have to give the same answer as well, because we list all the patient assistance programs. And whenever there are questions about people who maybe don't fall into the eligibility of an assistance program, we also always say you have to call the program, explain the situation. And patient assistance programs do make hardship exceptions. So you always just want to call the program and double check, but groups like NeedyMeds or HarborPath don't necessarily, or unfortunately don't, make the rules with that. So,
well, and I will say, Elizabeth, down the line, I didn't have this on the Future of HarborPath slide, but that is something that is in discussion at our organization, especially as we move toward full implementation of the Affordable Care Act and potentially more people who are insured but won't necessarily be able to afford their copays. We are exploring options for the future to be able to provide copay assistance. But again, we're in the crawling before walking phase, but that is on our radar.
So I think there's a little bit of a confusion between NeedyMeds and HarborPath. I'm just going to clarify, because there's a question about medications that are listed on our website versus yours. So to clarify, we just list information. We're just like the clearinghouse for all different kinds of assistance programs. So any of the medications you see listed on our website or the patient assistance programs, we're not running those programs. We're just connecting you to those programs. And what HarborPath is doing is a little bit different. They're in the clinics kind of streamlining the application process. So we're just kind of doing two different things and all trying to help people. But I just wanted to clarify that. So we're wondering if there's a plan for adding other states. Question, this person's in Illinois. They want to know how that was going. I think, so yeah, is there a plan at all, Noreen?
Well, the plan is to continue adding sites in the states that I mentioned. But again, if there's a clinic in Illinois and they make contact with us and we have a discussion around sort of what their level of need is, certainly if they've got, patients who could benefit from this program, we will absolutely entertain working with them.
Okay. Are there any other questions? Don't seem to be. We'll give everyone another second. Again, that's it. You can see Noreen's contact information if you want to request a copy of the slides. You'll be receiving an email from me just with links to the recorded webinar, and you can always get in touch with me if you have any NeedyMeds related questions at all. Okay, so I think we'll wrap up. Thank you again, Noreen, for doing this webinar. We're really excited to have you on, and hopefully this was helpful for everyone in attendance, and everyone has a great afternoon.
Great. Thank you all.